This is your heart. Right now it's beating about 70 times a minute, 100,000 times today, and you won't think about it once. But for half the men watching this, something is already going wrong inside it, and you won't feel a thing until the day you do. I'm Cole Harmon. I'm a nurse, and the part of this job nobody warns you about is the hallway. The walk from the room to the waiting family when you have to turn a man into a past tense. I've made that walk for men who felt completely fine a week earlier. I'm making this so one of you never makes me make it again. Today I'm going to show you the 7 mistakes quietly stealing years from men over 50. Not scare tactics, not supplements. Just what the science actually says and what to do about it. Every one of these is preventable. Let's go. Let's start with the one the supplement industry has lied to you about. Because the truth here actually takes weight off your shoulders. Yes, testosterone falls as you age. Roughly 1 to 2% a year after 40. That part's real. It's in the data from the Massachusetts Male Aging Study. But here's what the ads won't tell you. Genuinely low testosterone, the kind with real symptoms, only affects about 2% of men. Even in your 70s, it's around 5%. Not 1 in 4, 2%. And the symptoms that actually track with low testosterone are sexual. Low drive, weak morning erections, not fatigue. When the big trials gave testosterone to men who really were low, published in the New England Journal of Medicine, it improved their sex life and mood. It did not improve their energy. A JAMA study found it did nothing for memory. So if you're tired all the time, low testosterone is probably not your problem. And that's the good news because the real causes are ones you can actually fix. Your sleep, your weight, your stress. Chasing the hormone just sends you hunting in the wrong place while those keep draining you. Your move, get your level checked only if you have the real symptoms. Low drive, weak morning erections. Otherwise, don't let a gel ad turn a normal number into a disease. Fix the sleep first. Before I say a word about mistake 2, try something with me. Picture sitting down on the floor, then standing back up without using your hands, your knees, or anything to push off. Could you do it cleanly? If you're not sure, sit with that uncertainty for a second. That feeling is the mistake, and it has a name. Sarcopenia, age-related muscle loss. After 50, you lose muscle faster and strength faster still. Around 3% of your strength every year in your 60s. And here's why it outranks your waistline. In a study in the BMJ following 500,000 people, grip strength, just how hard you can squeeze a hand, predicted who lived and who died. Picture that. Not a scan, not a blood test. A handshake telling you the odds. Weakness isn't cosmetic. It's a vital sign. I've watched a single broken hip end a man's independence in one afternoon. A man who, a year before, called himself perfectly healthy. That story doesn't begin at 80. It begins right now in your 50s, with strength you're losing and not replacing. But here's the relief. This one is almost annoyingly fixable. A meta-analysis of 49 trials shows older men rebuild real muscle with resistance training. So here's the prescription. Plain, 2 full-body strength sessions a week, push, pull, squat, carry, is enough to begin. And eat more protein than you think. Aim for 25 to 30 grams at every meal. You cannot supplement your way out of this. You load the muscle. That's the whole secret. Now, the one I opened with. The heart. And I won't soften this part because it's the most dangerous mistake on the list. A study of 25,000 people in the journal Circulation scanned the arteries of healthy men. No symptoms, no diagnosis, feeling completely fine. About half of the men aged 50 to 64 already had plaque building in their coronary arteries. Half with no symptoms. This is the stalker. Plaque doesn't start at 50. It's been building since you were a teenager. Decades. Silent. And in about half of all cases, the very first symptom a man gets is the heart attack itself. There is no warning shot. I've seen the shock on a man's face when his first warning was already the emergency. When I feel fine and the ambulance were the same morning. This is what it looks like inside. Watch the channel narrow year after year, and you feel completely normal the entire time, right up until the day it closes. Now here's where the pressure lifts because this story has a way out. We can see this before it ever hurts you. A coronary calcium scan, a quick CT, catches it early. And catching it works. In the Scott Hart trial, in the New England Journal of Medicine, finding disease early and treating it cut the 5-year risk of a fatal heart attack by 41%. Your move, ask your doctor for a calcium scan, and for 2 words most checkups skip, ApoB and Lp(a). They catch risk a standard cholesterol panel misses. The stalker only wins while it stays invisible. Let me tell you about a man you might recognize. He's in his 50s. Feels fine, works hard, no real complaints. So the screening letters go in a drawer, and the appointment he means to make becomes the appointment he never makes. Why go looking for trouble when nothing hurts? He isn't reckless. He's exactly average. Men see the doctor far less than women, and about 1 in 3 adults who should be screened for colon cancer aren't up to date. Here's what the drawer can cost him. In the clearest number in medicine, colon cancer caught early, still local, 5-year survival around 91%. Caught late, after it spreads, about 13%. Picture those 2 doors side by side. 91 and 13, same man, same cancer. The only difference is which side of the door he was on when he walked in. That's not luck. That's a colonoscopy. Your move, and the list is short. Colorectal screening starting at 45. Blood pressure checked every visit. And if you've ever smoked, ask for a one-time ultrasound of your abdominal aorta between 65 and 75. Almost no one tells men about that one, and it catches a silent killer. The appointment is the medicine. Make it. It's 3 in the morning. You're asleep. You think you're resting, but your airway is collapsing. The air stops. Your oxygen dips. Your body jolts you just enough to gasp and start again. And then it happens again and again. Dozens, sometimes hundreds of times before sunrise, and you won't remember a second of it. That's obstructive sleep apnea, and we treat it like a punchline. We shouldn't. In one population study, nearly half of men over 40 had meaningful sleep-disordered breathing, and roughly 80% of serious cases are never diagnosed. Here's the tell most men miss. It's almost never the patient who notices. It's the person lying next to him. The partner who watches him stop breathing, counts the silence, and waits for him to start again. If anyone has ever told you that, they were handing you a diagnosis. Take it, because it isn't harmless. Untreated apnea is strongly tied to high blood pressure. That link is rock solid in the New England Journal of Medicine. And to stroke, and to irregular heart rhythms. Your heart is fighting for air all night while you think you're resting. And now I'll be straight with you, the way most channels won't. The big trials did not prove the CPAP machine prevents heart attacks. What it absolutely does is stop the choking, give you your energy back, lift your mood, and help control your blood pressure. Your move, know exactly when to get tested. Loud snoring plus daytime exhaustion, witness pauses in your breathing, or blood pressure that won't come down on medication. Any one of those, get a sleep test. Don't write off a serious condition as just snoring. Take a breath, because this one is mostly good news. You've heard that sitting is the new smoking. That line is a lie. The researchers who get quoted on it called it misleading themselves. So here's the real story, and it's lighter than the scare version. The risk is real. I won't pretend otherwise. Globally, inactivity is on track to cause 500 million new cases of heart disease and diabetes this decade. And 8+ hours of sitting a day carries its own risk on top. But you are not doomed by your desk. And here's the proof. In a study of over 1 million people in The Lancet, the men who sat all day but got about 60 to 75 minutes of movement in, basically a daily walk, erased almost the entire risk of all that sitting. Picture that, a single walk, quietly canceling a whole day's damage. And you don't need 10,000 steps. That number was a 1960s pedometer slogan, not science. The real data on older adults says the benefit maxes out around 6,000 to 8,000 steps a day, and even less still helps. Your move, and it isn't a gym membership you'll quit. Get up every 30 minutes and take 1 real walk a day. Movement is the most underrated medicine you already own. and it's free. When men disappear, they call it being private. Medicine calls it risk. The seventh mistake is the one men never file under health at all, being alone. And it is not soft. It's one of the most studied findings in medicine. A review of 300,000 people in PLOS medicine found men with strong social connection had a 50% higher chance of survival. The risk of isolation is comparable to smoking and bigger than obesity. It hits the heart, literally. Isolation raises heart disease risk about 29% and stroke about 32%. And here's the hardest number I'll give you today. Men die by suicide at nearly 4 times the rate of women. It climbs with age. Older men carry the highest rate of anyone. We were raised to carry it alone, to not bother anyone, to be fine. And it is killing us quietly. So here's your move. The most concrete one on this entire list, and the easiest to start today. Text one man right now and put a date on the calendar. The friend you haven't talked to in a year. The son you keep meaning to call. That's not weakness. Looking at the data, it's medicine. So there they are. 7 mistakes. The hormone you chase instead of your sleep. The strength you don't rebuild. The plaque you can't feel. The appointment you keep skipping. The breathing that stops in the night. The sitting and the silence. Now look at what every one of them has in common. The plaque is invisible. The muscle loss is invisible. The apnea happens while you're unconscious. The avoidance hides behind feeling fine. The isolation has no symptom at all. None of these kill men because they're dramatic. They kill men because they're quiet. And men are taught to ignore quiet problems until they're loud. That's the whole game. Aging well isn't waiting for a warning, because the warning is the very thing you're trying to prevent. It's refusing to let silent problems stay silent. Looking on purpose at the quiet stuff before it ever gets loud. So don't try to fix all 7 this week. Fix one. Pick the quietest one, the one you'd most like to keep ignoring, and drag it into the light. You have on average 20 or 30 more years in front of you. That's not a countdown. That's a runway. Act like it. I'm Cole Harmon. If this was worth your time, subscribe. There's a new one every week, and I'll keep telling you the truth even when it's not what sells. I'll see you in the next one. Muscle and Medicine 50 Plus is for educational purposes only and is not medical advice. Always talk to your own physician before making changes to your health, exercise, or nutrition. This content does not replace professional medical evaluation, diagnosis, or treatment.